Health leaders say masks should be used for people who are sick and healthcare workers. And now a local hospital is working to make sure they don't run out. They've changed procedures to make sure the supplies aren't used unnecessarily. Our reporter Emma James joins us live from Children's Mercy. So Emma, break down how this lack of gowns and masks is having an impact.
Well, Kevin, right now these signs are up in Children's Mercy locations all across the metro. They say if you have fever, cough, or cold symptoms, please ask the front desk or security for a mask. Now, the hospital tells me it wants to be clear it's not facing a shortage of protective equipment right now. It's simply planning for the future.
This station is a station that allows for people to wash their hands as they're walking by.
Dr. Angela Myers says it would typically be filled with hand sanitizer, tissues, and masks. Today, the masks section is covered up with this sign, pointing folks to the registration desk. Myers says the hospital needs to conserve them along with other protective gear.
We want to make sure when patients and families come and they have respiratory symptoms that there's a mask available for them.
Myers says a lot of masks are made in China, where factories aren't making as many of them right now. Along with the push to conserve protective gear, the hospital is trying to limit the number of people going into patients' rooms who need to put it on. That includes physicians and volunteers. I asked how the hospital will make sure its patients still receive the same care and interaction they would get from volunteers.
We are relying on our clinical care staff who need to be entering the room frequently to take care of the patient, including the nurses, including physicians.
She says it's important to keep in mind there are a lot of respiratory viruses circulating right now. Her advice to the public?
So I think we all just need to take a deep breath and a pause and recognize that most patients with viral symptoms at this time of year have a routine virus and not COVID-19.
And another thing she wants folks to keep in mind, if you do think you might have coronavirus symptoms, don't feel the need to rush to the nearest emergency room or urgent care. It is reasonable to call your primary care physician. Reporting live in Kansas City, Emma James, 41 Action News.